Hello, I'm Slayton Gorman, Chief Revenue Officer at PairCompass. The current state of the world as we know it is creating more need for us to bring rationality to healthcare through price transparency and cost control. And what really makes it all work is the sharing of ideas and truly working together. As an embedded solution partner within the Health Rosetta ecosystem, we are excited to be a part of the recipe that has proven effective for several large groups already. In this session, you'll hear how major differences were made for two reputable businesses through collaboration and incorporating the Health Rosetta blueprint. First, we'll take a look at a case study covering the Gasparilla Inn in sunny Boca Grande, Florida, where healthcare prices run up to 2,000 times more than the standard cost of Medicare, and how combining reference-based pricing and direct contracting, plus other key strategies, saved the day.
Gasparilla Inn Club is a upscale island resort located on the southwest Gulf Coast of Florida. They started in 1913 and they will enter their 107th season in October. It was sort of known as a playground for the wealthy from the north, and it was people like the Morgans, the DuPonts, the Fords had come there for years and so forth. They basically had some many challenges they were faced with. They were averaging about 15% rate increases from an insurance company when they were fully insured. And they also are located in the most expensive healthcare in the United States, the southwest Gulf Coast of Florida. The markups could average over 2,000%. And so we were faced with the task of trying to bring their costs down. They wanted to go become self-funded. We found PairCompass as we built our FairCo health plan. So July 1st of 2016 is the first year they became self-funded, and the results have been astounding. They have saved about $3.9 million over the first 3 years in working in this FairCo health plan, along with PairCompass, which is a key component. And their impact on the renewals is they literally have had 4 years with no rate increases, 1 year with a rate decrease. And it's been a great opportunity to take these benefits, and they literally are 10 times the benefits for about 30% of the cost. And they have things like no deductibles, no copays, hardly any out-of-pocket exposure for the employees at all. And they've been able to save that kind of money with that kind of benefit program. Things like surprise medical billing that are real issues in today's times. If you go to a doctor's office and they start doing pathology on you, blood lab, everything, that's covered with like a $15 copay back 30 years ago, if you will, to these kind of benefits. So I believe it is the richest benefit plan in America with no deductibles and very few copays.
Well, thank you, Carl. It's been a pleasure working with you and the folks at Mitigate Partners and Gasparilla Inn for going on 5 years now. So it's great to see how it all comes together. You put together a tier 1 provider for the group, tier 2, and then we wrap it with reference-based pricing is where PairCompass comes in. So the results that we see from our piece of this has been amazing in the last 4 years. Again, we're starting year 5 right now. We see about a 1% balance bill rate. We've got 1 claim open we're working on. All the rest have been closed out. Either they were settled at a reasonable percentage of Medicare, or in many cases, we were able to get them written off entirely with no additional payment. So we're seeing about a 1% balance bill rate across all the claims that we, PairCompass, see from a reference-based pricing perspective. Also, based on the savings of the plan, seeing about almost an 80% savings of allowable to charges. So amazing results. We're happy that you and the folks at Gasparilla Inn are happy as well. So been able to settle all those claims. You can see here on the slide, the numbers are phenomenal. Back to you, Carl, if you can tell us a little bit more about the plan.
Sure, Kelly. You guys have been great partners, and seeing that we're, one of my favorite words is the cartel. Seeing that we're in the middle of a lot of really cartel hospitals down here, and have seen some crazy bill charges come out. $198,000 for a fractured radius, not a shatter, not a break. Crazy things like that, that if we had been in the traditional Blue Cross, United, Cigna, Humana, or we call it BUCA model, it would have been reimbursed at about $100,000. and I believe we paid 7.
Yep.
So that's a big difference. And I think what they really wanted to do was have employer-built healthcare, not insurer-built healthcare. And that's really how they achieved this. They eliminated the middles. They got rid of all the middleman, and we went with an independent third-party administrator. We're unfortunately on our 3rd try, but I think we finally got it fixed. 3 strikes and you're out. You know that from your daughter's softball. But I think we finally got a great partner, and we're really excited about that. We're working with Ather now, and we've done transparent pharmacy benefits. We have a pharmacy consultant who's worked with us every step of the way. It's been a tremendous ride, if you will. And we've had some rough claim years, Kelly. If you go back and look at that first year and the year we just wrapped up, the bill charges for this last year, again, this employer has about 185 employees on average. They usually have about 140 year-rounders, and they're there from July to October. And then October comes and the seasonals show up, and we swell up to about 215 employees for pretty much 6 months. There's about 450 total employees, 270 of them are benefit eligible. So that's been the challenging part. But this past plan year, 2019 to June 30th of 20, the bill charges were a little over $8 million for that small of a group. That shows you how crazy the prices are down here in this corner of Florida. They also, for the first time ever, this renewal, just July 1st, we did have to have a small rate increase because it was such a rough year. But that's the first one in 4 years. So we're proud to say that I think you guys have done a great job at helping us hold it down. And again, assembling these 16 plus solutions inside the Fair Cost Health Plan that we started in July of 16, I think has been also a critical part. Things like chronic kidney disease management, musculoskeletal, again, a transparent relationship from the advisor to the client where they know exactly what we're making. We also have had that transparent relationship with a third-party administrator. The only money the third-party administrator gets paid is their PEPM admin fee. They make no money on any of the solutions. They make no money on Payer Compass's solution. It's a straight pass-through to the client, and that's what we're real proud of. So our client actually holds most of the contracts. Kelly, I think a couple of other significant things that we've done here. They are committed to improving the benefits year after year after year. And today with Affordable Care Act, if you get a colonoscopy done and you go in and like they normally do, it's a preventive colonoscopy, you're over 50 and you get it done. I'm over 50 and I still haven't had one done. My wife knows, please don't make a big fuss over here because I don't want to hear it. But if you're over 50 and you get a colonoscopy done and they find out that you have a polyp, and they remove the polyp, it becomes a diagnostic colonoscopy, and therefore it's not covered at 100%. So the member's responsible. So what the hotel did is they started covering it 100% no matter if they find 30 polyps. It's just another example. The ologist that we talked about, so Kelly has to go to the hospital, and all they have is a copay, an admission copay, $250 inpatient, $250 outpatient, $500 inpatient, hardly anything. You go in, you see the ologist, the radiologist, the pathologist, the anesthesiologist, and then you get all these bills coming at you from all the directions like, hey, what is this? Why am I paying it? They made it where that copay takes care of all of that. I hadn't seen it in any other health plans, including our other fair cost plans. So they are always constantly improving it. And I think there's 2 benchmarks that I've often said that matter in a health plan. It's the medical expense per employee per year and the drug expense per member per month. Through 2018, the plan year that wrapped up June 30th of 19, their medical expense per employee per year was $2,993. The national average is $12,125. Their drug expense per member per month was $47.53. The national average is $100. Those were achieved with all these solutions in the Fair Cost Health Plan that are following the Health Rosetta principles. But a big part of this, Kelly, in all honesty, is Payer Compass because we're in the most expensive healthcare in the country. And therefore, those billed charges, I think you saw us, around 19 million total bill charges since 16. And I think we paid out just shy of 2 million, right around that, something like that. So it's kind of crazy, but y'all been a great partner, and I appreciate the opportunity to speak today about the success that Gasparilla Inn has enjoyed in this relationship with FairCo.
Carl, we appreciate your time today. Thank you for sharing the story of Gasparilla Inn. We look forward to many more years to come. Thank you, Carl.
That case continues to be a true testament to the value of our alternative self-funded plan models. Working with motivated, informed partners, it's easy and even inspiring to come up with creative, flexible solutions that bring sustainable healthcare and savings for employers and their employees. This next case between PairCompass and Custom Inc. is a story that expands on the recipe of RBP with direct contracting. Take a look.
It's a pleasure to be here today talking about Custom Inc.'s Live Well Health Plan. Custom Inc. is a custom apparel and gear company. We have about 1,500 employees, and the organization has been around for about 20 years. Custom Inc. has had a history of providing excellent health care for their employees. It's a self-funded plan over many years, and we've gotten many awards for one of the best places to work. So about a year ago, we embarked on a plan to be able to elevate our care, our medical plan, and be able to contain costs so that we continue to offer the kind of medical care that we had historically. So we embarked upon working with the Health Rosetta ecosystem with risk strategies to put together a program for the Live Well plan, where we could provide the same type of benefits: zero deductible, low co-pays, excellent service through a reference-based pricing model. And we had a very tall order to fill. Our CEO wanted each individual inker, as we call them, to be happy with this change in our healthcare. And in order to do that, we needed to partner with some excellent folks to get that done. Because in addition to the traditional reference-based pricing framework with the Health Rosetta system, there was a desire to pre-negotiate and have what we call safe harbor providers, so that our inkers in various geographies would have providers that were contracted with the plan in advance. And PairCompass played a key role in, prior to launch, going out and helping us be able to pre-negotiate with a lot of those providers.
Thanks, Carol Ann. PairCompass has certainly enjoyed the last year working with Custom Inc. and all the other key players in this, your advisor, Josh Jeffries, administrator, and Web TPA, and many others. So what Custom Inc. set out to do is not your typical reference-based pricing program. Doing that much upfront negotiation, really forming a narrow network, a lot of hard work to get ready for go live, which was just March 1st. So we've been doing this a few months, but all of us played a key role. So everybody that had a relationship with a provider, we reached out, whether it was your advisor, Health Rosetta has some, PairCompass certainly, but we've all reached out to providers in those very different markets, because your inkers are spread all over the country, to get high quality providers to come to the table and talk to us about contracting at a percentage of Medicare. So, and then we wrap it with just, plain RBP, I'll call it. So it's been a busy year, but I think we're off to a successful year. A lot of savings with the claims coming in. Any balance bills just now trickling in. I'm going to work those. So it looks like we're seeing about 62% savings to charges on the claims we've processed so far. Again, we just got started in March with a go live. So so far the numbers look great, and we're so happy to be part of the recipe here with Health Rosetta.
And when you put in, it's about 10,000 providers, I think, that we have negotiated with. We were given a charge to try to get to 90% of previous providers, and we've gone well beyond that.
Excellent. Yes. Tall order, but I think all of us working together with the Health Rosetta and all the key components that have far surpassed our goals a year ago.
And one of our challenges was pre-negotiating in different markets. So the Northern Virginia area, Dallas area, Reno, LA, and the Payer Compass outreach team did an amazing job. I remember sometime in November, we got a pediatrician in Texas, wanting to work with us before the plan went live. And I ran to Carol Ann's office and we did a high five. Every pre-negotiated provider that comes in is like a huge win. It's like that first time. So we're really thankful for the Payer Compass team.
And another thing that was awesome about going through a transition, because any transition is hard. So we worked in conjunction with our partners, and Katie Sue was the really piggybacked a lot of this, but we identified what we called our VIP inkers and worked with Payer Compass and others to negotiate single case agreements for all of those inkers who had pre-existing conditions. And the attention to detail, in addition to looking towards those big, relationships, what Payer Compass did on an individual level for folks who had, an oncologist here or, a high-risk pregnancy was incredible. And oftentimes it's really the devil's in the details. And I would have to say that Payer Compass really has that attention to detail, which is behind the scenes. So when you talk to an inker, they may not, be able to say, who's Payer Compass? But it is really what they are, who kept the lights on and kept this really awesome plan running as we launched it right before a pandemic. Perfect timing.
Thanks, Carol Ann. I think what's important now is taking all this information. We have all this detail and this data, all this data, and being transparent, and now giving that back to Custom Ink, to Health Rosetta in various data feeds so that we can analyze data more than ever, and so we can put good action into place going forward. So now that we've gotten started, we got data coming in on all these providers. Certainly, next step is getting that data back out to Custom Ink, Health Rosetta advisors for actionable results.
With the Gunter Group, worked with Health Rosetta and worked with us on a change management process to really enhance the inker experience. That's what we call our employees, inkers. So having that assistance to help on the employer side to make employees happy was really beneficial.
Well, Carol Ann and Katie, thank you so much for your time today. I appreciate you sharing your story on how the health plan, the new health plan for your inkers started, several first few months of implementation. Appreciate you sharing your story and your time today with us at the summit. Thank you.
Well, thank you, Kelly. It's been our pleasure to be able to be a part of this, and it's been a pleasure to be in partnership with Payer Compass through this journey, and we're looking forward to continuing to navigate and learn as we move into the plan for the following year, and hope to be able to see everybody in person next year.
It feels good to know we are making a difference for the employees and the families of Custom Ink and the Gasparilla Inn. The level of access, transparency, and savings is a result of collaboration and innovation. It's been said that rising tides lifts all boats. That's been our experience, and the results in these cases prove that true. We're all witnessing the positive outcomes of working together with Health Rosetta advisors and sharing in the mission to provide better care and reducing health benefits spending.